Are you suffering from reflux, whether it is silent reflux or LPR, or the traditional form of reflux, which is GERD or gastroesophageal reflux disease? Oftentimes people find that they end up having to do the fundoplication surgery in order to tighten that lower esophageal valve and prevent the reflux from causing them symptoms. Unfortunately, most traditional doctors will go straight to either prescribing you PPIs or proton pump inhibitors, which destroy your gut health. They are not designed for use more than 6 weeks at best, but most people end up spending a lifetime on them. Or those doctors will eventually recommend you undergo a fundoplication surgery. The more I work with clients, the more frustrated I get at just how disconnected traditional medicine is from the health of the whole organism. When you have reflux, the number one thing we need to go to is your gut health. This is your digestive tract. Oftentimes, the reflux is caused because of poor digestion. You either have candida overgrowth or small intestinal bacterial overgrowth or intestinal methanogen overgrowth, or usually all of the above, and that can lead to leaky gut or intestinal permeability. In other words, your gut bacteria are not in a good balance. Most people have shot digestive health because of the food environment that we are surrounded by, filled with very high carbohydrate foods, high fat foods, alcohol, stress, smoking, lack of physical activity. All of those things conspire together, and now you have an unhealthy gut. And what triggers me the most is when those patients have all of the digestive symptoms. They have gas, they have bloating, maybe diarrhea or constipation. They are in severe digestive distress. And what is the recommendation? Oh, you can just do the surgery and then you won't have the reflux. What do you think is going to happen to the gas and the bloating? If you already have a lot of that, you're refluxing. It's a form for your body to relieve that pain and that pressure by removing those gases from any outlet. Now imagine if you shut off that outlet, how much more pain are you going to be in? How much more distress and cramping and more bloating are you going to be in? It just blows my mind that we don't address the gut health first and foremost before we go to such extreme measures and risk all of the potential drawbacks of and complications of surgery. I'm trying to remain calm as I film this YouTube video, but I cannot put into words just how frustrating it is when we know that there are so many things that are easy things that are going to treat the root cause of the reflux, but most doctors are not going to recommend it, and unfortunately most patients tend to listen to their doctors far more than they tend to listen to nutritionists, even though doctors are not trained in nutrition. Barely a chapter on nutrition in their full 7 years of medical schooling, and that chapter that they give them on nutrition is so off base. It follows what the Academy of Nutrition and Dietetics puts out, which is basically eat all of the grains and minimize fat and minimize red meat, the one food that our species thrives on, the one food that our species evolved eating for 99.99% of its existence. All right, so if you are struggling with reflux, please address your SIBO, address your candida overgrowth, address the no-brainers before you take this drastic measure, because there's a very high chance that if you already have digestive distress and then now you go and you prevent your body's ability to relieve some of that discomfort by releasing those gases and via the reflux, now you're probably going to end up with even worse bloating, worse pain, worse cramping. You're going to end up most likely in a much worse off position, and you might have to go to a revision surgery and reverse it. I have plenty of YouTube videos on this channel talking about how you can eliminate SIBO, you can eliminate candida. If you just do a carnivore diet right off the bat, those two things have been reported to be eliminated on a carnivore diet, both SIBO, intestinal methanogenic overgrowth, and candida overgrowth. You could add in some antifungals and some natural herbal antibiotics like berberine, for example, caprylic acid, or oregano oil. There's a bunch of stuff that we could even add into the mix if you don't want to allow the carnivore diet to take its course and wait a few months until you get full remission. So why not treat those health issues at the root? And as a bonus, you're probably gonna lose weight, improve your mental health, have more energy, and have a renewed zest for life. I will send you a free copy of my guide, the 30-Day Carnivore Diet Challenge Guide, when you sign up to my newsletter at DrZALDIVAR.com/newsletter. And if you are interested in one-on-one coaching, check me out at DrZALDIVAR.com/coaching. And if you know somebody who's suffering, make sure you share this YouTube video with them before they take those terrible steps that are going to mess up their gut health even more, as opposed to treating the root cause of their reflux. All right, that's it for me. Thank you so much for watching this video. If you liked it, make sure you give it a thumbs up, subscribe, and hit that little notification bell icon so YouTube alerts you every time I post a new video. I will see you in the next one.